Right.
Good morning, everybody. Thank you all for being here. It's 10 o'clock and I think it's time for us to start. I'm trying to get y'all out of here as quickly as we can today for this, because of an organizational meeting. We'll have work to do starting in September. So I'm calling the meeting to order. If we can go around the table, Lisa, this way if we can, and I think most everybody knows everybody, but maybe not, and let each other know who you're representing, okay? So Lisa.
I'm Lisa Wheelis. I'm one of the counselors at First Light High School, so I'll be representing the school part.
And I'm Beulah Ashby. I am retired from Dare County for 30 years, and I was on the hospital board.
Randy Benninger. I'm a relatively new resident of Manteo the last 3 years, so I guess I represent the newcomers. But I have a background in healthcare policy, patient advocacy, and when this was formed, I said, I can do that if they'll take me, and he did.
I'm Todd Clisole, I'm representing Manteo.
And I'm Malcolm, I represent Susan.
Amy, 3 girls. Yes, dear. I'm Jim Tobin, I represent Dare County.
I'm Sheila Davies. I'm the Director of Health and Human Services.
I'm Kevin Phillips. I own Island Pharmacy.
I'm Tess Judge, and I'm here on behalf of Alabama Hospital.
I'm Amy Montgomery. I'm Senior Administrator of Operations at Alabama Hospital.
And let me say this about the hospital and the county government. I am so thankful that, and I knew Ronnie would be, and I knew Tess would be, true to their word when we talked about that in the public meeting, that they would be willing to participate in this and help solve and address this issue. I thank y'all and Bobby and Jim for the county for y'all's willingness to participate. This is, I know, appreciated by the people of America Island and in the town, from Mayor Owens and Todd and Melissa and her staff. This is a good group of people, and with this group of people, I know that we're going to do good work, thoughtful work. Might not be as quick as some of us would like, but as in other issues that we've dealt with, it's most important to do it correctly instead of quickly. And in these conversations that we're having, there will be no criticisms of anybody. The only conversation I hope that we can focus on is solely patient care. How to take care of the patient, period. And how we can improve that. There's a lot of wonderful things that we do in healthcare, especially within the hospital. The programming the hospital does is a great asset to our community. And the only desire is to, as it is a national crisis, is to improve. That's the only purpose. So, Melissa, if you would give us the kind of what the scope of work for the town of Manteo. We're organized under the town of Manteo, and they gave us some direction in which they would like for us to follow. So, Melissa has that copy, and she'll will give everybody a copy at some point in time.
I can email this to you. So first, I'm Melissa Dickerson. I'm the town manager for the town of Manteo. I appreciate you all and your willingness to be involved in this discussion and helping us address these issues. To streamline our communication, the town did set up an email address where the public can send their questions or comments that maybe we can address with the work that the task force is going to do. That email address is healthcare@manteonc.gov. And so town staff will check that email address regularly. We will summarize those things and provide to you the contact information that we receive from individuals and the questions, so that maybe weekly y'all get a summary of what's coming to that inbox and not having to keep up with all those things yourselves, because we do want to make this work as efficient as possible. So I summarized some of the points that the town's Board of Commissioners noted in their discussion when they appointed you all to this task force. And so I just wanted to run through these things, kind of how this is how similar committees that the town has worked before, and it seems to work well. So this is kind of what our commissioners reviewed and what I'll share with y'all, and of course I'll follow up in an email and send these things to you. So of course the town of Manteo established this healthcare task force. The task force will meet regularly, and we'll discuss times later on in the agenda of a regular meeting time. If there is a reason that you all would need to meet outside of that regular meeting time, we will accommodate that, much like we did this meeting today with a doodle poll to compare schedules and such. The public will be able to participate in these meetings and bring their ideas forward. The task force has been charged with identifying and defining the healthcare needs of the community. You all will review, analyze, and examine the ideas and concepts proposed by residents and citizens regarding healthcare needs. After research and discussion, you all will then have an opportunity to make recommendations. Once you all have identified those needs and have recommendations to send forward, I will then take those and vet them appropriately for governmental, legal, financial, obligations that would go along with those considerations. And then, of course, once I've done my homework on your recommendations, I'll present those to the town Board of Commissioners. So, and of course, Mr. Alton is here today, and so once we get those recommendations from you all, if it's appropriate at that time to address the county, I will coordinate that with him as well.
All right. Any questions regarding that? And we'll get you a copy. We'll get you a copy.
We'll send it around. Yes, sir.
So everybody has it. And with that, we all have a good web email address.
Yes.
Okay. We all have a good email address. Okay. We're having on the fourth item of the agenda will be a public opportunity for comment. I don't know, there's a couple members of the public here. I don't know if anybody would like to say anything or not, but always I think it's important to hear from the public. And without a ring-a-ding-ding that Tim has, they have a bell now on the head. So if anybody would like to have anything to say, Randy? Or,
no.
Okay. All right.
Can I say one thing real quick?
Okay.
My name is Andy Garman. I'm the town manager with the town of Nags Head, and I learned about this through Melissa. She sent me an email notifying me of the meeting. Our board did talk about the same issue last month. They knew that the town manager had been proactive in taking this healthcare task force on, and so I'm just here to sort of listen, and I think the town of Nags Head is interested in the issue and appreciates what you're doing. So appreciate the opportunity to be here.
Well, thanks for being here, and I hope we can work together on this. Okay. Again, I want to reinstate the advocacy is patient care. What can improve patient care? And that's the whole. That's also mental health. And I'm going to introduce somebody. Randall, if you. He's one with the blue shirt on his back.
My wife told me to wear this. So.
My wife laid on that too. So,
I don't believe that.
so it's been interesting in the last few months, the people that have been willing to volunteer and offer advice and wanting to serve. Randy and his wife were fairly new to the community, but they're very active. And Randy has an interest in mental health. So while Randy was not appointed on the task force, if it's okay with this group, there'll be people that I will pull in or if you know someone to fill in that can help advise, I think that would be beneficial to our efforts. So Randy's really, his interest is crisis intervention, trauma treatment, and counseling. And when we talk about the whole body, something I've learned, if someone has a devastating illness, it can definitely affect their mental health. So that, Lisa, that's Randy with blue shirt. So Lisa works for the school system, and that is her interest also. So there'll be another individual that has joined us in conversations with the town named Franklin Walker. He is with a physician's foundation in Chapel Hill. Rob. His wife is a doctor, actually. And what they do is they try to place staff in rural areas or the areas. And there's in their recruitment, there's incentives for them to serve in those communities, one of which is payment up on their loan programs. So we're not going to be recruiting for the hospital because that's not an forte to be. We could uncover maybe opportunities that could help the hospital in their decision making. So 5, healthcare decisions discussion. Again, this is more of an organizational meeting, and if we can open this up, if we can, and discuss the direction of where y'all would like this group to go, because until today, it's been limited in advocacy and without structure. So, Tess and Amy, y'all are probably the gorilla in the room as far as dealing with the most patients. And I want to say thank you for your moving forward with the clinic here on Rhode Island. That's exciting. It's welcomed, and that's really a lot of people are supporting that effort. So would y'all like to start it off?
Well, happy to be here today too, and I think all of us in this room are about what's best for the people in our county and our community and our surrounding communities, our citizens first and foremost, or all of our desire to take care of them. And I think anything that we can do at any time to provide more care for everyone is exactly what we all want to do. I think sometimes when you get a group together, you sometimes learn things maybe that you didn't know before, so it's always helpful to hear what other people have to say, and I think working together, we certainly can do that, and I think we're so much stronger as a whole when we do try to work together on issues. So I'm looking forward to working with everybody, and it's always been the goal of the Outer Banks Hospital as long as I've been on the board, and Ms. Buell over there as well, that the welfare of the people of Dare County is it's why we're here, and it's why we're here today.
I echo those remarks. I know one of my first jobs in Dare County was I worked at the Dare County Department of Public Health as a public health educator, and so near and dear to my heart is access to health care for individuals in our community. In fact, I helped conduct the first community health needs assessment for Dare County. So I've been deep in that work, and I'm very interested in that work, and I feel fortunate that I work for a hospital that also has the same mission. And I wouldn't work at the Outer Banks Hospital if every time we make a decision we ask, how does this impact the community? Will this increase access to health care for the community? And the recent things that have happened, although they're really unfortunate and they've been hurtful to individuals in Manteo, I can say, and I think we've gone on record to say, that these are issues that we have been working on for over a year. The knowing that we need to improve the facility in Manteo, working on hiring and keeping providers in Manteo. Those are things we've actively been working on all along. And to that end, We remain committed to improving access to health care for people in Dare County, our residents and our visitors. And I'm happy to participate on this task force because, we'll give you new ideas of things that we can do that will improve access. So I feel fortunate to be here and to be an advocate for all people in Dare County, including visitors and residents.
Thank you. Kevin has a different perspective because he fills the scripts. And as my dad did, well, maybe we shouldn't give medical advice. Your pharmacist is pretty close to the patient. And Kevin it's wonderful to see him follow his father's footsteps in the community. Kevin?
I'm also on I'm vice chair of the Dare County Board of Health and Human Services too. And one of my things is always, I bring up at the meetings a lot, is the mental health aspect. So I'm very glad you're here, and I really hope he makes it on. The transition has been quite, I'm going to just say bumpy, put it that way. I will say that y'all have finally put the teledoc number in, because for a while there I was just telling people, I can't go, I even called the North Carolina Board of Pharmacy trying to figure out how to do emergency fills, and they wouldn't call me back. So I should call the Board of Pharmacy back. So it's been very difficult in my realm, so I'm very thankful that we have this task force. But since they've given that phone number, they can do a teledoc, but they only get 1 month. So we really need to get this ball rolling. So they'll do the telehealth, they'll give them I had trouble getting insulin for them. So be the person says, hey, look, I can't get your insulin right now. It ain't fun, as they would say. So, and then I was able to take care of them with that 800 number. Mandy over there has been stellar. Mandy has helped me tremendously and helped me help people.
Yeah, and to Kevin's point, something to clarify for this group, we are as you've heard, we're highly regulated in healthcare, right? If this were easy, everybody would be doing it and we wouldn't be in this issue. But we can only, by law, we can only continue to assist patients for 30 days after that provider leaves. And so that's something that we're just bound by. Although we love to help forever, we're bound by that regulation.
And what's not really brought up much too is that insurance companies rule the roost too. So if I do ever figure out how to get okay, I can get you a 30-day emergency fill, but when I'm audited, the insurance companies can take that back. Well, that box of insulin is $500. And if they get 2 of those in a month, that's $1,000 directly out of my pocket, then I go out of business too. Not that anyone cares about my business, I'm not being blunt, but my business is not important to people of the community, it's important. But if I'm not here because I'm helping people like that, then I'm going too. Same thing with y'all.
That's right.
The insurance companies have us nose to the grindstone.
Yes.
And it's not about people in that realm. So, but that's nothing we can fix here.
Can I ask you about the regulation? Is that a state or federal regulation?
We are regulated in that manner by the North Carolina Board of Medicine.
So that's a state. Okay. Well, Jim?
One of the things that public health, and Amy alluded to this, has historically done in communities is community health needs assessment. We have, by law, we're supposed to do that every 4 years. We do it every 3 years in collaboration with the hospital. Nonprofit hospitals have to do it every 3 years. So we partnered a number of years ago, so we weren't duplicating efforts and switched to the same timeline. One of the things that we look at is what people identify are the greatest needs in the community, and access to health care has been on and off the top 5 for, the last probably 3 assessments. We at one point had, under the Healthy Carolinians of the Outer Banks, an access to health care task force, and that was active for a number of years. It's currently not an ongoing existing task force. That, some of the challenges that at the time that group was looking at were, what is driving the access issue, and certainly this is a system level, analysis that needs to be done as far as when you're looking at the challenges facing access to healthcare. because you've got the things that we think of right now that are the most pressing for people is just getting doctors and appointments and all, but the other things that factor into that are, payer availability of insurance. Do people have insurance, transportation, prescription coverage? So historically, access to healthcare was really impeded by transportation. That's not the big issue in Manteo. The most pressing thing now is the availability of providers. But I think what will be interesting and what we're charged with from the Manteo board is identifying and prioritizing what are the most pressing things that are impacting patient care, and where we can help with any of the identification of that. We're happy to because we have that background. And I have spoken to Ronnie about, we understand this task force is designated and developed by Manteo, but there's a greater need in the community too. This isn't just a Manteo issue. And so if there's a way that Healthy Carolinians needs to re-engage with that task force to support whatever comes out of here on a wider scale, we are open to that too. The board would be open to discussing it.
The last assessment y'all did, when was that?
We just completed it. We have not, we're in the process of finalizing it so we can release it to the community, but we literally just wrapped it up a few months ago. And in that, I think it was about 23%, I'll have to pull the data back out, of survey respondents identified access to healthcare as an issue. The top issues, which is all, we know it's all encompassing for mental health and substance abuse. But the way the survey is designed, those are separate items than access, even though they're all connected.
Is that something you could share with us?
Absolutely. We could do a presentation even at the next meeting. So
okay. Could we do that then?
Absolutely.
Okay, great. All right. Great. And have y'all done one within the hospital?
We do it together.
Do it together.
Yeah, so it's a joint assessment.
Okay, great. All right. Anything else? Mr. Tobar.
Okay, I'm going to get in the weeds a little bit. Sorry. I'm one of the people that was, in my opinion, discarded from the system. And I've been in conversation with well over a dozen people about their feelings and what we can do to fix the problem. One of the things we can do, of course, is get the doctors back in there, which you guys are well on the way. But there's two main focuses that those people had that they wanted out of their healthcare providers. The number one thing was trust. And every single one of them felt that they had lost trust in the system. So that's going to be a high hurdle for you guys. Sure. I think that as a group, we need to figure out how to put that trust back into them. I personally think that a good way would be to send another letter out of apology and say, we're sorry we had to do this, but this is how we're heading forward. And as you know, you gave us an array of doctors to call and possibly get on. I myself didn't do that. I thought about it long and hard, and I said, you know what I'm going to do? I'm also in the Duke healthcare system, so I said, I'm going to go to Duke Family Medicine and get a doctor there, just so I can see how that facility that's not a corporation operates. And I have been to the doctor there. So it was kind of your first appointment with a doctor. One of the main complaints I got too was their first appointment was limited in time to whatever it is, 15 minutes or whatever. The doctor spent 45 minutes with me, and the nurse spent another 15 to 20 minutes with me. I was in the room for 70 minutes in the exam room. And I think the corporation needs to extend that time period that they can spend with the patient. That's a main concern from everybody. The care part, that's part of the care. They felt like they weren't getting the care that they needed because they felt like they were kind of on a conveyor belt. Okay, we're done with you. Okay, next. We're done with you. Next. That's a problem. And that's a widespread opinion. That's even an opinion of people who weren't let go out of the system. And I don't know how you're gonna do that. You know, I understand you guys are in the business of making money, but, you know, there's also the oath that all the doctors take that say that they will supply care. Care is important. And we all need to figure out how all of that can work. One of the other things that most of them said, not all of them, but most of them said that they felt like there wasn't any competition. And we don't know if that's a certificate of need issue. If it is a certificate of need issue, I don't know if our county can get another certificate of need. Sheila, can we? I don't know how that works.
Primary care, you don't have to have that.
No,
That's
primary
for the-
care, but they were saying there was no competition to go to, and they felt like that might be one of the issues on why Vidant, and trust me, I'm not trying to throw you guys under the bus. I'm just expressing what the people I've talked to have said. And maybe that's one of the reasons Vidant is doing what they're doing. So I think we've got a lot to work on, and I think those areas that I said are really important, especially the trust issue. And, well, really, in reality, the care issue too. They go hand in hand. But
I really appreciate your comments because that insider information really helps us in you know, organizing and planning and rebuilding trust. So thank you for sharing that. I do want to clear up a couple of things. Primary care doesn't make money.
yeah, I know.
And we are committed to increasing access to health care, although that's, you know, a loss on the bottom line. We are committed to increasing access to primary care, 100%. And in terms of you know, I think Sheila answered the question. There's no certificate of need of competition. And I mean, I'll just remind folks that there was competition here prior that pulled out.
Yeah.
We refer to Vidant Health, it's now ECU Health. ECU Health has not pulled out. We've had providers leave. Outer Banks Hospital and ECU Health is still here working hard to provide access to health care. So if we could start there, and if you guys could trust me and Tess and believe that.
We do.
It's true. But other health care corporations who are bigger than we are, who have been thrown around that people are talking to, they have pulled out on Dare County. We have not.
A couple of the people that I talked to, along with the prescription thing you were saying, one of them was 98 years old. 98 years old. And I think it was very insensitive, and I truly think a letter of apology would be golden.
I made a note because I think that's a great idea. I really do.
And I think too, you know, hindsight's always 20/20,
Yeah.
unfortunately. But I think what happened because of the reasons that had to happen. But I think if we look back and we talked about this, we talked about it with Ronnie, we talked about it with Jay Riley, and so forth, if more information had been included in that original letter, while it still wouldn't have made the outcome any different, there may have been some more understanding of why. And I think that definitely was a problem.
May I interject? When Malcolm and I were first talking about this, I'm like, it's not Dare County. This is nationwide. And she brought up the main thing down there, that there's no money in primary care. That's why you see so many urgent care centers.
Well, and there's no money in urgent care either.
Well, it's more than primary care.
No.
Then there's a problem.
There's a bigger loss in urgent care than primary
So
care.
there's a problem throughout. So we don't need to just have this meeting in Manteo. This needs to be in Raleigh and D.C.
All over.
I contact my guys all the time for my stuff. So this is way bigger than Manteo.
And there are hospitals all over the country pulling services like L&D, pulling surgeries because they can't find OR techs and surgeons to work in their ORs all over the country. Connecticut, New York, Pennsylvania. Hospitals closing, ORs closing, labor and delivery units because of the great resignation in healthcare. And it's not just primary care that you know is a struggle. It's most of the specialties in healthcare, and I can promise you we've got our heads down working hard in all of these areas to keep all of these services open and continue to expand.
Can I jump in on that? I don't know how many of y'all knew my dad, but he was real patient because he had me. And I remember, and I'm not going to go into all that, but he typed with 2 fingers. And I wasn't married, and I was in the pharmacy and he was doing his prescriptions. And I was, this is not right, this is not right, this is not right. And he tapped out and said, damn it. He said, don't give me your problems, give me your solutions. Okay? And that's what I hope this is about.
Amen.
And when you made that comment, I hope at our next meeting, we have a solution, a pathway to a solution. Because if primary care is unprofitable, then I hope we can bring forward a solution that helps with that lack of profitability and patient care and solving that patient care. So hold on to that thought for our September meeting because I believe that's coming. That's coming. Jim, anything else?
No, that's it.
Todd?
I was going to say thanks for everybody for participating in this task force and all the work Melissa and others have done, and of course my friend Tess. Love seeing you guys here representing the hospital. I think just the main reason we're all here is because we were just kind of like shocked by the letter and being dropped from something that we just become so used to. And not only is it just a doctor, I mean it was a doctor that you had faith in, you talked to, you know, Dr. Farrow was my doctor. Dr. Holt was my doctor at one point. And it's, you know, it is, it's like Jim said, there's a lot to it other than just going in and getting a prescription. I mean, you open up to them, they open up to you, and you have that trust. And it might just be this day and time that those days might just be gone. You go in, you get your prescription, you tell them what's wrong, you go out, you see Kevin. But I'm just not comfortable with that, especially being in a small town like we are. And I think I was at Duke last week, and it's a different experience. And the specialist that I met with was actually telling me that he's got 2 years to decide whether he's coming on with Duke, whatever it is, their corporation or the corporate part, or he's going to have to go out on his own. So it's everywhere. I mean, it's the big boys are squeezing the doctors everywhere. But at some point, I think Dare County, being, as I always bring this up, the 3rd largest tax generating county in the state, you know, we ought to be known for our beaches and our safety and our small communities and what we've got. Because I'm telling you, everybody that comes here to visit and stays in Airbnb and stays downtown and eats at Poor Richards, it's the first thing they say. They love the town, they're safe, they love all the amenities. But I think one of those amenities needs to be health care. My parents moved here, and unfortunately my mother didn't make it long. But the trip she had to take was to Virginia, and she did come to the Outer Banks Hospital for some cancer care. My father, you know, is very limited. He didn't last very long either. The long-term health care is very limited. So it is probably beyond the scope of this task force, but we really need to figure out how we can establish health care that makes the older population feel comfortable moving here, because when you move here and know you have to drive an hour and a half, 2 hours away to see a specialist, you know, it's kind of discouraging. So you come here, you get in your 80s, and you're like, we got to go somewhere else because we're just not comfortable with it. So I just think at some point, along with the hospital, we need choice. Not just bite it, but we can't get caught in this situation again. You know, if there's choice, like Spectrum, I mean, that's it. Or you can go to Dish. I mean, and it's kind of, I mean, that's what you got. But I mean, you do need options. And I'm not saying anything about the hospital because I've been there many times, unfortunately. But they've always taken care of me. I've got friends that work there. But I just think that we can come up with the beginning of a solution, and it's going to be a long-term solution. But make Dare County somewhere where people like a Hilton Head, or, you know, that people can go and be older and feel like they're being taken care of by the specialists that are provided by this area. And what you just said scares me to death, saying, I mean, why does anybody even do it if there's nobody making money? I mean, I don't understand that. I mean, if I didn't make money at the restaurant, I'd be coming to Bobby asking, can I drive the garbage truck? I mean, I gotta do something. I gotta do something
You're hired.
to make money. I'm not making sandwiches to break even. I'm just not gonna do it. And I don't understand how anybody can do that. And you know, I hear that their bottom line is millions and millions, and a lot of the millions goes to support the smaller suburbs or the smaller towns. And I don't know all that, and it's not really important, but what is important is that this task force come up with a solution to provide the health care, primary, obviously, that the citizens of not just Roanoke Island, but I think Nags Head, Kildare Hills, Kitty Hawk, I mean, the whole area is going to be in the same solution, predicament before too long. So that's all I have to say.
Yeah, even though I am trained in the law, I will try to be as brief as possible. Otherwise, they'll vote me off of the panel. May do that anyway. I was one of the infamous 2,500, and I think you all know what human reaction is to that sort of thing. Given my professional background, I thought, okay, A, this could have been done better. B, community, and I just make that general. I commend Manteo for taking the lead in establishing this group. But as soon as you scratch this problem, you know it goes well beyond just the boundaries of Manteo or even Roanoke Island, and that it affects people who live up and down the Outer Banks. So it's complicated, I know that. I think the fact that we don't have a payor at the table, or at least showing up, is a problem, because a lot of this goes back to the reimbursement that physicians, hospitals, other kinds of facilities have. So, and I see nodding heads, people who are dependent on some of that reimbursement. I just sent in a large check for medical bills. Where was my insurance? But anyway, I think the issue of restoring trust is critical, not just for the institution of the hospital, but I think across the community, because I'm not sure everybody thinks, oh, it's the hospital, or it's, as they say, it's the health system, or it's medical care, and you know, cool on all of you. I think we have an opportunity as a body, particularly if we work through the avenues of getting information out, whether it's through the public health department, whether it's through the press, whether it's through the town and county, that we are here, that this is a very representative group and will draw others and invite, I can't tell you how many emails I have from friends who say, fix it, fix it, fix it. I say, well, I just got on. But I think we should not be shy in letting everybody in Dare County know of our existence, of the opportunity for them to come bring their story here, as the chairman has said, and for the commitment of individuals and organizations to this function. And I think that could help in the trust. There are lots of other pieces, but from where I sit, I think letting people know, we heard you, we're going to move on this. Yes, it's complicated. We know that. But it does not mean it cannot be improved. I won't say fixed, but certainly improved for all of the people who live here. And I include specialty care in that. I am of the age where I keep meeting new specialists, and I don't want to do that. I represented physician organizations for years. I'm very doctor shy, but it's just a reality of life, and it's a reality of my social set here on the island. I keep looking for young people, and my wife is one, so I say. Just a question on two things. The assessment on healthcare. I would certainly, as a newcomer, unaware that is done. I would love to see that as a focus? I'm sure you look at other issues, but as a focus on the healthcare piece, I think that would be very important, and I certainly would welcome the opportunity to hear the report of the latest information. One other question, and then I will shut up, is in talking with people, some of whom are involved here, some of whom are just my friends and neighbors around, no one seems to know what the healthcare population, and by that I mean the professional population, is in Dare County. Is it just the Outer Banks family medicine? Well, of course not. But who's out there? And literally, and this is people of generations here as opposed to weeks, who say, we don't know. So I think if we could put on our list very quickly, and I think we have people here who have many of the answers, identify what we have now. And because if we don't know what we have, we don't know what we're missing. And so I would certainly encourage that be a priority, a first step in the evaluation and work that I know we're all committed to. And I am delighted to be in a room with so many experts and so many people of long standing in the Outer Banks. I'm amazed that I got onto this panel. It's like I was born yesterday as far as everybody else is concerned, that I talk to. So, but thank you for the opportunity and the privilege of being here and working with all of you.
Real quick, a little bit more about your profession, what you did and where you did it. We're not going to hold that against you, but you worked in Washington.
All right. I already said I was a lawyer, and now we're really going to ruin my credibility. I started in the healthcare sphere. I am not a healthcare professional. I don't pretend to be. With the American Medical Association many years ago, working as what they call a legislative attorney, which is essentially a health policy analytic position. I wound up in their Washington office, which meant I was up close and personal to the sausage process in Washington. I won't go into that. And I then started my own firm, which was, I'm sorry, I'm going to use the word lobbying firm. And we represented healthcare organizations that included patients, professionals, institutions, manufacturers, the gamut, and I ran that company for 25 years, and then got tired of being the guy people would come to and say, there's no toilet paper in the men's room. Wait a minute, I don't own this building, go call somebody else. So I have a perspective of dealing with all the pieces, one way or the other. Not that I have worked for them. I've been, frankly, a political consultant to them, but I've seen a lot. And in the latter part of my life, I was just lucky enough to have really massive pulmonary embolism in both lungs. I was even luckier to survive the experience and be here today to annoy. But I got involved with a voluntary patient organization that deals with that particular disease. So I served 9 years as a volunteer, just doing the kind of work you all know from your efforts here. And then became the chief executive until I said, no, I really have to retire because I'm tired of trying to raise money. But it gave me an opportunity and perspective on patient advocacy, which I would say at the end of it, and I did a lot of that with groups like the National Hemophilia Association, was a client for many, many years. So I did a lot of that when I was working in Washington as a lobbyist. But my last part of my career before I retired was strictly patient advocacy, patient education, patient awareness. And I literally had people call me from emergency rooms on Christmas Day saying they're not treating my mother right. What do I do? Can you get her? Where is here? I lived in Northern Virginia. I'm in Louisiana. I said, I don't think I can make it. But it was that kind of thing. So I have I think I'm very sensitive to those kinds of concerns. they go well beyond the specific health issue that I addressed and continue to have to deal with. Thank you, genetics. And but that's my background. That's where I come from. I've been doing this since 1976, one way or another. And when this issue broke, and Malcolm spoke at he and I both spoke at the county commissioners meeting when they discussed this, and then at the town meeting, I said, I know he's got an office down the street from me. I got to figure out a way to meet this man. Weasel my way in there, because this is what I've done for a long time, and I hope that what I've done will lend some value to the discussions. And if not, I'll just rant.
A real reason is Tess told me I had to call him.
Thank you.
And I thank you for that, Tess. All right, Rick, thank you.
Okay, all right. As everybody knows, I'm Beulah. I was born and raised here in Manteo 69 years ago. And when you're talking health care 69 years ago, it was non-existent. I was delivered by a midwife, and the first doctor that I think that I ever went to or went into a doctor's office was Dr. Harvey. And my brother was born there. We couldn't believe it. I mean, he was a baby brother. But when you broke an arm, or you had something going on, or you were stung by a bee, you got snuff or something put on your face, and you just had to chop it up. But when we did finally get health care here, and when we got our hospital here, you just don't know how happy and proud that we were in this county, because we needed it so desperately. Having to go to Elizabeth City or Norfolk to have a child that you might have in Currituck, you know. So, but you know, and working on the hospital board I was so excited to do that, because I wanted to make sure that, having lived here without health care, that the people who now live and move here have the best care that we, Dare County, can provide. And I was not a part of the 2,500 letter people who got those letters. But unfortunately, a few years before that, my primary care provider was let go from her position. And I was wondering, what am I going to do? I mean, I've been with this woman for almost 15 years, and she knows me, and she takes the time, and she really listens to me, and she, you know, she's got me where I am today, healthy, thank the Lord. But so when she left her practice, like you, I had to stop to think, well, will I go to the new person that they put in there? And I did. And I felt like I was like a RoboCop. I went in there, and she never engaged. I talked a few minutes, but she never touched me. She never, you know, I just felt like, give me that $50 and you're just going down the street. If you need a prescription, you come on back. So that's the way I felt. So when my doctor decided to go out on her own, she didn't take Medicare, or she didn't take, you know, I self-pay. But I would rather self-pay and have the care that I have than to be without the care that I might get from some of the other people that I see. So I was happy to serve on this board, because I know that Dare County has the resources. They can make sure that the people here get what they need. Now, I was very disappointed when I found out that that clinic was closing, because I know so many people who have been with those doctors for years. I mean, you're talking about our oldest population was with those physicians. 33 years. Yes, and I couldn't understand, how that could happen and it be closing without bringing in somebody. I don't care if you have to call a hospital and get somebody to see those patients, but I do understand, as I see across the nation, that there seems to be more urgent cares now than primary care. Because, like you said, with primary care, if you've got a good primary care doctor, you're not going to leave there in 15 minutes. That person, if she's good or he's good, he's going to talk with you, and he's going to, make sure that whatever's going on with you, that can work through. But when you go into urgent care, you go in there because you need that help and that care right then. But they may not know anything about you. And it's a good thing now that with pharmacies like yours, that this doctor knows what this medication is that they have, because in the past, they were giving people all kinds of stuff. So, yes, I was a little taken back when I found out that practice had closed. But I do feel that there's enough people in this county, there's enough professionals, and there's enough money that we can make sure that our people are taken care of physically. And when I say access to health care, one of my main concerns is mental health. Now, during our crisis with having to stay home and people work from home or not be able to leave because of the pandemic, you've got to see how devastating it was for some of our people. And especially the older population. Even if they got to go in and see a doctor, at least they got to go in to see a doctor, or they go in to see a therapist. They get to talk to somebody. So we just got to make sure that we don't only address physical health, we also have to address mental health. And I don't take that lightly. And I say that because if you have a child who has a mental health issue, and you've taken them and they're on your insurance, and after 26 years old or whatever, that's expensive. So when we're doing this, I just pray that as a group that we look at every aspect of what we can do for our county, not just physical. Mental has to be a part of that. Plus, we got so many older people who now live on Social Security. Well, you know what Social Security was back in the day. I think my grandma maybe got $600. But if you got insulin that costs $500, what do we do to help these people? We haven't all, thankfully, retired and have health insurance or, had jobs that we had retirement. Those people didn't, and they still, just like the 98-year-old woman. If you don't have some money or you don't have some way of getting that medication, do you eat or do you get the medication? Do you pay light bill or do you get it? So all I ask is, I am happy to be here, but I also want solutions. I know there's a whole lot of questions out there. There's a whole lot of chatter. I'm not looking at chatter because I've seen what Outer Banks Hospital can do and will do, but I also want to see what we can do as a task force and get help for our people who need it. And not just Manteo, because we got people who drove from Hatteras, we got people who drive from East Lake, Stumpy Point. So even though this is a Manteo meeting task force, this is a Dare County issue. And it's not just our issue, it's all over. But we got people from Currituck that come here too. And as Amy said, we've had people pull out, and they have, but they're still here. So now let's try to solve what we got going on going forward. and try to get the best that we can for our citizens, and especially the ones who really can't afford health care, because there are a lot of people who cannot. So what do? Where do we go? We don't have free clinics where you can go and get everything that you need. Do we?
The community care clinic does
Well,
serve
but
patients
they
at
do,
a
but
certain
it's-
poverty level.
Yeah, but a lot, and I know that part of it, but some people they don't trust. And Amy, you know that better than I, that I've been on there, I've been on that committee, I was with the Healthy Carolinians, so I know what they do, and I know about how many people are served, and it's not as many as could be. So that's where I am with it.
Beulah, I really appreciate your comments. Every single one of them, I mean, I can feel and hear what you're saying. And I don't want to be the Debbie Downer of this group, but I want to be the realist of this group. And I hear the word fix a lot. And, I just have to say that, I've been in Dare County a long time. Like I said, the first health assessment 2002. I've been here, wasn't born here, but I've been here a long time. I've been working on a lot of projects, a lot of fundraising, a lot of nonprofit groups. Wrote the grants that developed the community care clinics.
That's true.
Right? Dare County has a spirit of, we can fix this. We've got this. We can put a group together and we can fix it. And I'm here and I've been a part of a lot of those groups. I am here to tell you, this is more complicated than that. This is bigger than anything I think that this community has ever come together to solve. I'm on the front lines, I'm deep in it, and it's complicated. And I think Randy can agree. I think Kevin, you're in it. It's extremely complicated, and I think the danger is, and I know I really appreciate Malcolm. You opened the group by saying we're not going to point fingers. We're not going to, and that's the best thing we could do because it is so complicated. And I've heard, I was dropped, and I feel so sorry for every single person who got that letter. And I apologize for the way that, the communication was handled. But I'll tell you, the reason it happened the way it happened is because we had providers who made choices to leave. And the last I checked, adult human beings have a choice to change their careers, to do something different. And in the past couple of years, we have had this great resignation in healthcare. And it's not just us, it's people from all over the country just deciding to do something different with their life because we've come off a global pandemic. People are burnt out. It's extremely complicated in healthcare right now. And so when we have providers make choices, and they're doing it all over the country, it's not just here. We hired locums. We went out and paid top dollar for travelers to fill the gap while we were recruiting. We've been recruiting for the current providers who just signed on for over a year. And so we put temporary providers in place as a stopgap, which if you check around, most healthcare corporations don't do that. The provider leaves, they send the letter. Sorry, we're done. We didn't do that. We hired the travelers. We put the travelers in place. Well, then the travelers, for their own reasons, decided to give a 30-day notice. We had no choice. And that's why we had to send the letter. And, quite honestly, we're on our heels because we thought we had a solution, but then all of a sudden our travelers decided to make a different choice. And so I apologize for the way the communication came out, but I can tell you we did our best to try to keep it together until we could get these full-time providers that we've been recruiting for over a year. And those aren't excuses, those are facts, and they're well-documented facts. But I say that because we've got the global pandemic, we've got the great resignation, we've got insurance companies, we've got payers, we've got cost of living, we've got a special niche community. I can tell you it's very difficult to hire providers here. It's a very difficult thing. We love this place. Who wouldn't want to live on the Outer Banks? Yeah. But I will tell you, it's very difficult to recruit a provider here. And some of the reasons for that is when you work in healthcare on the Outer Banks, you're a generalist, right? I've lost an MRI technologist because they can go to Raleigh and just scan knees all day long. That's all they have to do. You get paid top dollar to do it. On the Outer Banks, if you're an MRI technologist, you're a generalist. You have to know it all and do it all. And so providers, like people in healthcare, make decisions. Am I going to work there? You know, am I going to be a primary care physician in Dare County? I don't know if I'm going to have all these specialists around me that I might have in Raleigh. Or a young provider may say, well, you know, I want to work in an ICU, and you don't have an ICU. So, you know, these highly trained, highly qualified healthcare professionals make decisions about where they live based on their career and their specialty and what they want to do. And we're special in that when people move here to work in healthcare, a lot of times they have to do it all. And in an era of burnout, that can be challenging. And so I just want to say, yes, we're good. We're solution focused. We're working hard. I'll come with solutions all day long. I just want to be the realist at the table that says, this isn't going to be easy to fix. This is complicated, and we have to be ready to just be open to all of the things that complicate this issue.
And as you were saying, as far as temporaries, I've talked to some of the nurses and some of the doctors. And they came here, I mean, because it is beautiful, it is the beach. But when you get here and you realize what you have to do and what you got to pay to live here, and you look at that as opposed to going and just doing MRIs on somebody's knee, then seeing and doing what you're doing and then having to pay all that money out or have to live an hour or two from where you actually work. So I understand that. But it still does not mean I don't want it fixed.
we all want to fix it, and we can do better. I know we can, but I just want us to be prepared that it's challenging.
And Ms. Field, I'm sorry, Ms. Field, and the practice is not closing in Manteo. The practice was never closing.
Okay. Well, the people thought it's how it was perceived. I never saw the letter.
And we heard that. You're exactly right.
Yeah.
But it's right.
I never saw the letter, as I said. I never saw that. But that is what everybody that I spoke to, and I was like, well, no, I can't see that happening. You know.
And healthcare is personal. It should be personal. Yeah.
And to Malcolm, I'm sorry, one other thing, Sheila. When we were talking about recruiting, and this has been going on, as Amy has alluded to, over a year, I personally was talking with a physician that was primary care. And he told me, I talked to him twice, trying to recruit him here, very nice person, would have been wonderful. But he said to me, he said, Mrs. Judge, I have 90 opportunities out there. I said, 90? He said, yes, ma'am.
With a lot more money.
That's good. Stupid question. Are there, for situations like that, and I'm sorry, I'm sort of ignorant in all of that part of it, are there any loan forgiveness programs with, you know, people that are just coming out of, you know, the programs and stuff like that where we could help them with that? Maybe that would be an
I think Malcolm and some of those folks found a fabulous foundation that actually brought Dr. Legay here. Yeah.
We've engaged with one that's being reactive to us. And I'm going to jump in, and this is not really a criticism, it's a conversation. And I think all of us that are in business, from the school to the county to the town to the marinas to the health department to KEP, everybody's in that boat. It's a tough marketplace right now. And I want to tell you the whole story about that fellow that walking the beach throwing starfish back in. Yeah. Remember that? Yeah. I don't know that we can fix it. I would hope that's the goal to fix it. But can we work together?
Absolutely.
As a group of community people to help it? Yes. And that is the focus. And I hope that we can get this behind us after today and then talk solely on things that we can do and hopefully, I hope, can bring other parts of this county together to help enhance it. period, and that's all it's about. If you talk to my 3 daughters, they'd say I'm pretty tough on them, but I love it. But I'm gonna be tough on them too.
As you should.
So I think that is, please don't take it as any personal criticism of what went on. We all do the best we can. And like I said, hindsight is 20/20. So I hope we can move forward with that after we hear today and then collaborate with one another on how we can make it better. And it's not going to happen overnight. And I'm realistic about that too. Okay, Liz, tell us from a school perspective a little bit.
She don't have a follow-up though.
I do that a lot.
I have to follow all of that.
You get to start next time.
Yeah.
Well, I'm in the business of listening and not really orating like all of y'all. I'm here because I have a passion for mental health. Obviously, I deal with it every day in my job. I see the needs of the kids. I think it's interesting that y'all are talking about health care for the older generation, but in order for us to get the teachers in and people to stay in the community, it also affects the younger generation too. So I'm just very delighted to be here and try to, help out in any way that I can, give you some information, from the school's perspective. There is a huge need for mental health for our students as well as for parents and family mental health. Because like you said, COVID may affect one person, but it also affects the entire family. So, or mental health. One child has mental health issues and it affects the entire family. So I do appreciate y'all inviting me and allowing me to be here, and it's going to be a very huge learning experience for me. Thank you.
Malcolm, can I share a couple of things?
Yes, ma'am.
So, in listening to all the comments and recognizing where we are, I think one of the things I think this group can do initially is some education and awareness. Because not only are we learning from each other, but there's a lot of learning that the community needs to do as well. Healthcare has changed so much. What our parents had for healthcare is not the healthcare system of today. Now, there are still some of those. I mean, healthcare today is not the hour-long visits that we used to have because payers don't pay for that anymore. Now, you can get some of that through concierge services, but those are providers who actually don't deal with the payers anymore. They say, I'm not going to deal with that hassle. I'm not going to deal with those regulations. I'm going to provide concierge services. And we have a few of those in the Outer Banks. But I think we could do ourselves, and certainly the broader community, a really great service for just providing some education and awareness about the evolution of healthcare. In addition to that, I think the inventory of services, what's here, so people understand it's going to be some trade-offs. I can get my insurance to cover, if I have insurance, XYZ services, but it's going to be according to the way X, Y, and Z services are reimbursed, or I can seek a concierge type service. But people, the general population probably doesn't understand that. And how could they if they're not in the mix of the system? So I think some of our initial meetings could be well spent with educating us, who in turn, we've got Mary Helen here, which is wonderful to do articles, but we can then also share at upcoming commissioner meetings, that type of education. So I think that's a big role we can play for the public. I think we can bring forth the inventory and see where our gaps are with different services. We have a lot of that already in public health. So we could bring it forth and then people could add to it. Oh, maybe you don't have this provider, they just moved here, this one just left. We try to keep up with it, but that's evolving all the time. And then we can also certainly do the community health needs assessment. So I think our next agenda could be pretty full, starting with education and that type of information. Because we need to manage expectations and to do that, educating the public and ourselves, and then where do we go? And all of that's going to help us with identifying the future direction of the group. So that's my 2 cents.
I totally agree with that, because as you were saying, I chose a different route, but other people don't understand that the reason I did that, or even that doctor exists and why. And, all I can say is whenever I can't see my own doctor. Advanced Hospital sees me. I mean, actually I had to be there 3 times since May, and I could not have asked for better care. I am every doctor, nurse, everyone I saw. I had COVID, I couldn't breathe, and I thought I was having a heart attack, and I was like, okay, I can't breathe. And I mean, they were on it. And I felt so wonderful knowing that I didn't have to travel to Elizabeth City or anywhere else to get the health care that I need. And they're the ones who explained to me what was happening.
Okay. A little bit past that now. Is there anything else in the general discussion?
Just something I wanted to, and maybe you all have seen this, but we talk a lot about mental health, and living in this county as long as I've lived in this county, that's been an issue, and it's an issue about everywhere, about mental health, substance abuse, all of that, and have dealt with that in my own family, so I know firsthand about it. And also know of the situations where when people have a loved one that needs to be hospitalized for those, for mental health reasons, and there's no beds available, and we've all heard of that. But and maybe some of you all have seen where there is going to be a new mental health hospital over in Greenville, 144 beds, and I believe it's going to be 24 pediatric beds, I believe. I know we're thinking we want to get to it before it gets to that stage, of course, that we can provide mental health services for people before they get there. But it's been crucial trying to find beds for folks that needed to be hospitalized.
And a lot of people are going to jail rather than getting the help they need because, they're doing things that had they been on medication or been able to be seen could live an everyday life. And, so.
Mental health is a disease, just like anything else. And Sheila, just correcting you and Amy, that the assessment, that's going to be to the public.
Mm-hmm.
The health assessment will go out to the entire public so that they can be aware of it.
Okay, to kind of wrap things up, I'm going to take a little privilege here. I'd like to have a vice chairman, and it's a Manteo committee, and I've asked the mayor pro tem, in case that I can't attend the meeting, if she would be the vice chair to run the meeting if I'm not here, and that's Betty Sylvie, if everybody's okay with that. The next agenda, community assessment, okay? I hope we'll have a primary care presentation for that meeting. And then, Sheila, you mentioned about the education.
Education, and so 2 things for that. One was kind of an evolution of healthcare in the U.S., and that's a big topic, but it could be condensed. Just some snapshots, I guess. But the other thing is the inventory of bringing forward. We can certainly bring forward the inventory of providers in healthcare in their county. And so that would be primary care, specialty care, dental care, vision care, behavioral health care. I mean, we have an inventory, but dental, I didn't say it, I wrote it down, pharmacists,
that's important.
Mm-hmm.
Yeah, so I'm sorry, Mr. Chair, where are we now with the dental care? I know that's something you and I've worked on over and over again. And the Miles and Smiles van, do we still have that for the children?
We have been trying to recruit a dentist at $180,000 for 6 months and have 0 applicants. $180,000, only have to work 10 months a year, don't have to deal with any of the billing, and I still can't get one.
And that is true.
That's technology would help me.
For those that don't have my cell phone number, if you want it, it's 305-8596.
But be careful when you put it in your phone because you will see a text from that cell phone number. Sometimes it's
4:35, 6 a.m.
We can take the next day, all right.
Don't be offended.
Don't expect me to answer after 8 o'clock. So if it seems like we would have a bit to talk about at the next agenda for the next meeting, I reckon now can we try to figure out, or we're going to meet on a specific date for the next few months
Whatever works best. If it is better to waive that we set this meeting up for everybody to weigh in and we identify that one time, this was the one time that worked for all of you. Or if we want to do I could send out a doodle, or if there's a specific time that works for you all, like a monthly time that we just reserve, that's okay too. I provided the chair with a list of existing town meetings already. My hope is that we would do it on a day that's not already, where I don't already, and Jamie already have meetings to staff.
And with that, I hope that moving forward, we can do it in a room in the county where they have, you call it,
Video?
multimedia.
We have that here.
In this room?
Right behind you.
Yeah.
Oh, okay. Well,
Set up
here.
backwards.
So if someone, with everybody being busy as they are, that, if there's a specific item on the agenda, they, and they can't make it, they want to be, on Zoom, we'll do that. The other thing for those that represent entities, if you can't make it, if you have a designee that you would like to attend, I would say it'd be a non-voting member, because the vote would be y'all's vote, because y'all were appointed. But if you had someone that you can't make a meeting and you have something that needs to be said about it.
But you could do it virtual or Zoom.
That's right.
And that
That's
person
right.
still
That's
could be
right.
there, so,
Is that good?
Yeah, go ahead and set them up.
Good.
yeah.
Ma'am.
I'm sorry, Mr. Chair. Would it be better today if we were able to do so, to set a date so that we all know moving forward? Because even with doodling, I think that's a great tool.
Yeah.
If we leave here today, and I'm just throwing this out, ladies
Yeah.
and gentlemen, if we say it's the third Tuesday at 10 o'clock in the morning, we look and that's something we can do, then we're set up. I don't know.
And that's why I brought this list, so we can go ahead and do that.
I would love for it to be the same day of the
Me
month,
too.
Yeah.
every
Tuesday.
month.
Yeah.
Like
Today
the first
Me too.
Wednesday
Right,
at 10
that's what I'm
o'clock.
saying, Tim.
Like
And then
we
we
did today.
know, right?
Yeah,
We
then you
don't
got
have
it
to
through the
schedule
year.
anything.
Right.
Well, does the first Tuesday, like this time today, I mean, you all are here, does the first Tuesday at 10 a.m. work for everyone?
Works for me.
It works for me, but if for some reason I
That's
can't
gonna be,
be.
it's gonna be tricky when you go back.
Yeah.
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 Works
think
for
so,
me,
yeah.
but
That won't work for September because of Board of Commission, because Labor Day.
Yeah,
For the county.
Yeah.
Their meeting is the sixth.
Move it up an hour maybe, and, so.
Would 9 a.m. work for you all?
Yeah.
that's right.
I don't care.
I just have to go next door.
That's easy.
Short commute.
This is what the date we're talking about, the first
Okay.
Tuesday, right?
Yes.
So for September, there's a holiday.
Commissioner
right?
Tobin, what time does your meeting begin?
9 o'clock.
9, okay. So we have a conflict for September.
Why don't you do Wednesday, if everybody could do that Wednesday just for that 1 month?
Well, we have our commissioner meeting on those. We could do it for September and then go back to the first Tuesday.
Or maybe make it the second Tuesday in September and then go back to the first
Yeah.
Tuesday. It's like the
That would
13th
work.
works.
Keep it simple, Tuesday,
Yeah.
10
Let
a.m.
me check.
Yeah.
I've got
And then in
We're
October, we'll go to
a
the
meeting in
first.
California that
Oh.
month too.
I'll try my best.
Yeah, I'm fine.
So
I
we're
think
gonna
that
do
works.
9 o'clock, is that right?
We could do 9 till, yeah.
And that would be.
Jim, does that work for you?
I think so.
Okay, the 13th at 9. And then this first Tuesday after that at 9.
Which would be October the 4th.
Oh, is that good?
Should we set aside an hour and a half just to give ourselves a little wiggle room? I think it's,
I think
I'm
so.
fine.
I'll take as much
This
time
is
as y'all are
important.
willing to give.
Yeah.
An hour and a half is,
Okay.
And I mean, even if it runs over a little bit, just to get our thought processes and going forward, just we need to.
I agree.
On September 13th, the Oregon Task Force meets in this room at 10.
Maybe,
So
maybe,
we're
we-
upstairs.
so you're on that.
I'm the chair.
Yeah, okay.
Yeah,
I mean, I could be at the meeting, but I'd have to be here at 10.
okay. maybe we can move upstairs I'll work with
Bobby,
Cheryl on.
or Cheryl. Okay,
Would you wanna do that one at 8:30 so you could participate in the full meeting?
8:30 or 8?
8:30?
So Melissa, do you ever need additional meeting space if this isn't available? We did our expansion and we now have a big meeting room as well as Health and Human Services.
Okay. Do you have technology in that room too? Okay, great.
I agree though, in an hour and a half,
Yes.
so everybody gets an opportunity. And thank you, Mr. Chairman, you certainly let all of us have an opportunity to speak,
Yes,
and that's what we need.
Can you tell Susan to go over there?
And also the earlier to me, as far as the meeting, the better.
Yeah.
To each one of y'all, especially the hospital, thank you for your willingness to serve. And one day maybe we'll talk about that starfish. But I am 100% confident that the goal is to fix it. But I know that we can improve it by working together. So, anything else?
Thank you all for the opportunity to rebuild trust. Thank you for the opportunity.
All right, thank you.
Doctor, your chest compression. Figure out where his chest was.
Being part of this with you.
I just think it's so much fun, even though it's, I did right, sure, I